everyone, it's Dr. Leigh here from Your Vet Online, and tonight we've got a very cool night for you. We're going to be talking all about pocket pets. Now, the other exciting thing we have tonight is we've actually got a special guest to help us with all of this, because sometimes, even though I've practiced with these guys a little bit myself, I think it's worthwhile having someone that does it all day and every day. So yes, we're going to discuss all those little furry little creatures. We're going to talk about rats, mice, guinea pigs, rabbits, ferrets, and all the little peculiarities related to each one of those. So we're going to talk about what to feed them, how to house them, and anything else that's extra special that you need to know. So let's get right to it. My name is Dr. Leigh, if you haven't already met me before, and I've been a vet for 18 years. Now, one of the key things, as I said before, is that although I've worked on these animals quite a bit in my emergency days especially, I would like to introduce to you Dr. Bree. And Dr. Bree is here. She actually practices at, make sure I get this completely right, at Camden, the Sydney University Camden facility, the Avian, Reptile and Exotic Vet Hospital. So extra special, yay! So welcome, Dr. Bree, and I want everyone to make sure they say hello and ask lots of questions. So, Dr. Bree, how about telling us a little bit about yourself?
Hi everybody, I'm Dr. Bree. I practice at the Avian Reptile and Exotic Pet Hospital, which is part of the University of Sydney, located, as you said, out in Camden. I have been a vet nearly for 10 years now, and I've worked at the university for 4 years, which is great. I get to see all different kinds of animals every day. Every day is a different day with the animals I get to see. So I work with rabbits, guinea pigs, ferrets, rats, mice, fish, lizards, snakes, everything. So I get to see lots of different things, and I get to work with lots of amazing people. It's really, really fun.
That's awesome. So guys, you've got a lot of experience here. So if you have any questions you want to ask, make sure you pop them in and we'll make sure we answer those. We might see them at the beginning, just depends how the talk's going, but sometimes what I do is we just wait until the end and go through them there. So why don't we start with rabbits? So let's see. Dr. Bree, what's the most important thing that you want us to know about keeping rabbits?
Probably the most important thing to know, and the thing that I get asked about the most, is diet. So yes. hay, and more hay. You can give them the right diet from early on, you're going to have a nice, healthy rabbit for most of its life. So
okay. Oh, carry on. I just got to say is because I know a lot of people love feeding them carrots and lettuce and all that sort of thing, and maybe a bit of broccoli. Is that okay?
So everything in moderation. So if you remember from Sesame Street, there's the Cookie Monster, and he used to always love having cookies. But these days now we know a little bit more about diet. We know that cookies are only sometimes food. It's exactly the same thing for carrots. So carrots are only a sometimes food.
Okay.
So I only recommend giving them only teeny tiny bits, maybe once or twice a week.
Okay.
Only when they're doing good things.
So a little bit like our dogs, where we might give them a little treat, and that's only for when they're behaving. Same goes for our rabbits then.
Exactly. Rabbits have a real sweet tooth, and they're very, very good at asking you to give them the naughty things. But you're not supposed to give them naughty things, only when they're being good and only in small amounts. So only a little bit. So I have lots of clients that say they give a carrot a day to their rabbits, and that's probably a little bit too much. That puts a bit too much weight on them. Carrots are quite high in sugar, and they don't have a lot of fibre in them compared to the other types of food that we can feed them. So we only want to give them a small amount and only a couple of times per week maximum.
Oh, okay. That's really good to know because, yeah, again, like a lot of the clients that I see with their rabbits, they do feed a lot of carrot. The other thing I was just going to ask, is there a particular type of hay that's better than another type of hay?
That's a really, really good question, and that's something that I have to deal with on a regular basis. So bunnies need to eat grass hays, and so that's things like ocean hay, timothy hay, meadow hay, pasture hay. So these grass hays are better for their digestive system, and they've got a better balance of nutrients. So we want to stay away from things like lucerne hay. Unless your bunny is a baby or it's pregnant, lucerne hay is too high in calcium and too high in protein, and can contribute to obesity and also bladder sludge, which is something we often see. And that's too high, the calcium building up into the bladder and causing this sort of sludge to sit in there, and it makes it hard for them to go to the toilet. So definitely grass hays when you're in your shop.
Excellent, good. So grass hay and not too many carrots, maybe only once a week.
Yep. So you want to give them lots of nice green leafy vegetables. So things like kale, only in small amounts as well. Any of your herbs, so parsley, basil, coriander. You can give them all your Chinese herbs as well. That's really good. And then you keep your carrots as your sort of treat foods.
Okay, got it. So do we need to desex our rabbits?
It's a really, really good idea to desex your bunnies, especially females. Unfortunately, by the age of 4, 80% of female bunnies will have a type of cancer in their uterus, and that can spread to their lungs, unfortunately. But if we desex them before then, we get a really good chance of getting rid of any of these sort of pre-cancer cells and any cells that might be wanting to try to go to the lungs. But also it's really important to desex your boys as well, because you don't want any unwanted babies. And also you don't really want your boy getting a little bit too frisky, let's say, and causing a bit of trouble around the house. And that can be urine marking, running around the children, those kind of things.
So can boys get a bit rough as well? Like are they with
boys do get a little rough? Yeah, they can get a little bit too frisky, and sometimes they can sort of mount your feet and chase you and nip at your ankles. And that's just them doing their little love dance, which they'll do to the girls. But we don't need that. And so it's good if we can desex them, because you will decrease those unwanted behaviours in your male bunnies.
Okay. Now, we'll often hear questions and queries about vaccination. What do we need to vaccinate our rabbits against?
So in Australia, we're only allowed to vaccinate against calicivirus. There's 2 viruses that can kill our bunnies, unfortunately, in Australia, and that's Myxomatosis and calicivirus. We're not allowed to vaccinate against Myxomatosis here, but we can vaccinate against calicivirus. And so it's really important that when you get a new bunny in, that you take them to the vets and you get a vaccination.
Okay, that's great. And so myxomatosis is probably more, your bunnies that live outside are probably more at risk of that disease. Are there any ways we can minimise them getting it?
Yeah,
or is it?
It's a good question. We can't minimise it. We can't get rid of the chance of it 100%, but we can certainly take steps to try and decrease the chances that they get it. And that is involving putting mosquito netting around the cage, making sure that you don't have any stagnant water around the bunny's cage. If possible, bringing them in around dusk when there's going to be mosquitoes around, and also trying to keep their cages clean, making sure that there's no sort of dirt around, even though it's not going to stop the myxomatosis virus as such, but it can just keep everything clean so that they're not sick, that the immune system isn't ailing, and that they can't sort of try and get on top of these things. But unfortunately, it's still something that does occur, and we can't help that. But we are lucky enough that we can vaccinate against calici, which is another fatal disease that bunnies can get, and that is also spread by some insects, as well as other bunnies, wild bunnies, being around the cages and transmitting it through saliva and secretions as well. And so you do the same kind of things, putting your netting up around the bunnies, making sure that wild bunnies can't touch them, making sure insects can't get in them, and bite them, bringing them in at dusk as well as vaccinating.
Okay, excellent. And as far as the bunny's home, the rabbit's house, is there anything special? Can they just live in your bedroom, or do we have to have a special cage for them? Or do they need toys for enrichment? What do bunnies really need?
Well, it's a good question. It depends on what kind of person you are. So some people like to have their bunnies inside the house, and we'll actually have them as free-range bunnies. You can toilet train bunnies to go into a litter tray, and so they will urinate and defecate in there. And so some people will have them around the house, and they will put them in a designated area to sleep at night time. I have some clients that let their bunnies sleep under their bed at night time, so they trust them a hell of a lot to go underneath their bed with their dogs. So you do have to make sure that if you do let them in the house, that you do bunny-proof the house. And so that's putting all your cables away, making sure that the area behind your lounge is free of cord, because bunnies like to keep their area really nice and clean. So they'll just chew at them to try and get them out of the way. But if you don't want your bunny in the house, that's fine. You can have them in an enclosure outside, but you want to make sure it's a nice big enclosure so they can run around, they can flop, they can do a bit of a bink, and that it's easy to clean. So we don't want anything that has any wire flooring, because that is really painful on their feet and can cause a thing called protodermatitis. And so that's where it gets all sore from sitting on hard surfaces all the time. And we don't want it to be a hard to clean enclosure. So we don't want it to get dark and smelly and sort of humid in there, because that can increase the chances of nasty bugs getting in there and flies deciding to lay their eggs in there. So you can do whatever you sort of want with bunnies, as long as you're committed to it. So like with my rabbits are free range. They're allowed in the house, they're allowed outside, but when I want to put them in a certain area, it's a nice safe area, no predators can get to them, they're out of the wind, they're out of the sun, they've got fresh water all the time, and there's nothing that they can get into that they can hurt themselves.
Awesome, that sounds great. Shall we talk about guinea pigs?
Sure, let's talk about the little piggies.
Yes, so again, what is probably the most important thing you want us to know about guinea pigs?
Similarly, like with rabbits, it's all about diet for these guys.
Okay.
Guinea pigs need to have hay as well to make sure that their tummies work properly, but they also need to have a constant supply of vitamin C, because these guys can't make their own vitamin C. Vitamin C is really important just for general health, also for skin. You heard of people getting scurvy. Guinea pigs can get scurvy as well if they don't get vitamin C. So it's really important that you do your research of what guinea pigs can eat and what they need to eat, and then be providing that on a regular basis. So your grass hay again, your dark green leafy vegetables, and then your vegetables and fruits that are high in vitamin C. So that's the main thing that I'd want people to know about that, and also the fact that they can get dental disease if they're not fed the right food, and that causes a lot of problems.
Okay, so should you be visiting the vet every year for your guinea pig to have their teeth cleaned and trimmed, maybe?
Yes, so everyone, even with your rabbits, guinea pigs, rats, mice, ferrets, everything like that, we do recommend that you give them, you take them to the vets every year to get a health check, and we will check their teeth. Now, if they are eating the right kind of diet and they've got great genes, then we won't need to trim their teeth. But if they've unfortunately been born with sort of bad teeth, or maybe a misaligned jaw, and they're not fed the right food, then we might have to give them a dental procedure and trim their teeth. And the important thing for people to know is, if your guinea pig does have dental disease, if they do need their teeth trimming, it's very unlikely that we can cure them of this. It's more of a management thing. So once they have dental disease and once they have these changes in their teeth and down in their roots, we can't necessarily cure that. We have to just manage it and try and make it as good as possible to keep them as comfortable for as long as possible.
Excellent. So what's a good treat for a guinea pig? Something they can have a little bit, like with rabbits, it was the carrot. Is it the same for guinea pigs?
Yeah, so guinea pigs love to have carrot as well. So you can give them carrot. They love coriander too. You can give them
delicacies.
Yeah, they love to have a nice big smorgasbord of vegetables. You can give them some strawberries, so occasionally strawberries as a treat. A little bit of kiwi fruit if they like that, a little bit of banana. But again, these are all treats. They're all quite sugary, So you just want to give small amounts at that time.
Okay, excellent. So they're similar. And what about feeding pellets to them? Like, I know a lot of people go to the pet shop and buy a big bag of pellets.
Yeah. So that's something that I have to talk to clients about regularly, is pellets with rabbits and guinea pigs. And even I grew up thinking that pellets was fine for rabbits and guinea pigs. But the more that we've learnt about their nutrition and their digestive system, the more that we've realised that pellets are not the best for them. They're great as a supplement, and only in small amounts, but not as the main part of their diet. And definitely not those pellet mixes that you see. So those pellet mixes, or commonly known as stud mixes, you'll see that they have a bit of corn in them. They'll have some sunflower seeds, and quite often we'll do a molasses mixed through there. And that's because guinea pigs and rabbits both have sweet tooth, and so they love these sugary foods and these oily foods, but they're not good for them whatsoever. Okay. So we want to try and stay away from those. If you do want to feed a pellet mix, a pellet food, you want to stick to the brands that actually have a nutritional analysis on the back, and you only want to feed a small amount as a supplement to the main part of the diet, which would be your hay and your vegetables.
So when you say a supplement, are we talking 10% of the diet? Are we talking 20? We're
talking about maybe 5 maximum 10% of their diet. So you're only giving them a small amount of it, because when we feed pellets to these guys, to any of our sort of herbivore animals, we actually change the way that their jaw works, and so it's not working in its normal plane. So when they're eating their grass and their hay, their mouth is working in a lateral sort of movement, and that's how we want their teeth to work, because that's how it wears their teeth down properly and keep them nice and healthy. But when we give them a pellet, they actually work in a vertical action, and so they're chomping up and down, and that's how you get the uneven wear of their teeth. So only a small amount. Unless they're really, really skinny, or there's a medical reason that your vet will tell you to increase it, you only want it a small amount. And there's some people that don't actually give any pellets to their rabbits or guinea pigs.
Okay. And so what about housing for them? Is it just the same as a rabbit?
It's nearly the same as a rabbit. So these guys do need to have lots of area to run around and move around, but they're also quite skittish animals, and so we want to provide lots of hidey holes for them. So we want them to be able to go in and snuggle away and feel nice and secure. If they want to get out, they're a little bit more of an adventurous type of animal, then allow them to run around. But we still want to make sure that they're protected from the elements too. So a nice big cage, fresh water, hay, an area to go to the toilet, which is different to an area for them to sleep, and then little tubes for them to run in, and little hidey holes and things like that.
Oh, fabulous. Cool. Well, shall we talk about ferrets now? Again, what is the main thing you want us to know about ferrets?
That they are mischievous little animals that like to get into all sorts of trouble. So many of the time we had people come in that they've lost earplugs and things around the house that the ferrets have decided is a good little treasure, and they've gone in and hidden it. So that's one of the things.
They've hidden it. They haven't eaten it.
Hidden it and or eaten it. So sometimes they like to hide them and we get them before they've eaten it, and then other times we get it that they've actually eaten it. So we have to go in and surgically go and find them inside the belly.
Okay. So does that mean that you've got to have a different type of housing for them? Is it safe to keep them out all the time, or is it even more important to have a special cage for them?
So it's very important that you have a ferret-proof house and a ferret-proof cage. So we recommend when you do have them out, which you should get them out to play, because they are quite smart animals, and so they do need that mental stimulation. But when they are out, that you're watching them, because they like to get up underneath the couch. They're really good at getting up inside recliners, and so when people go and then open up their recliners, the ferret is actually in there in amongst all of the mechanics of the springs. So you've got to make sure that you know where they are at all times.
You don't squish them.
And also that they don't get underneath the fridge and get stuck underneath the fridge, which some have done. And so it's important that you're watching them when they're out. And then when you do have your cage, make sure that it's a big cage that they can spend some time in when you're at work. So that has a designated area for sleeping, a designated area to go to the toilet, and then an area that they can eat that's away from their toilet. but also that that cage is secure, that they can't escape from it.
So again, what about food for ferrets? Is there anything special, and the do's and do nots?
Yeah, so ferrets are what we call obligate carnivores, and so their body is made to eat meat and meat byproducts. They can only handle sort of small amounts of carbohydrates and fibres, and so when we're feeding them, we want to find them a diet that is high in animal fats and plant and animal proteins, and low in carbohydrates and fibre. So you're looking at things like organ meats, muscle, as well as a good quality pellet food as a supplement as well. So there's some people that will feed just a pure raw diet and a sort of a whole prey diet to ferrets. And then there's some people that will sort of feed that, but in addition to a good quality either ferret kibble or a good quality chitin kibble as well. And so it just depends on sort of what your beliefs are. It divides a lot of people when we talk about ferret diet, but the main thing, no matter which way you do it, that you make sure that you're trying to cover all those bases of giving them the protein. We don't want to feed them sort of just plant things or vegetables. They're not going to eat those, and they're not good for their belly, and the bellies can't handle that. Feed them sort of prey food. So some people will actually buy them little mice to eat, or even go to the butcher and get a rabbit's leg to feed them, and then they'll give them a good quality sort of cat food or a good quality ferret food in addition to it.
Okay, and can they have cooked meat? Have we got any concerns about feeding them raw? Does that mean we have to worm them more often? Do we have to do anything special with the raw meat?
Well, it's always good to buy human grade meat when you are buying it. You don't want to sort of get the offal from the pet shops, because we don't know if that's been treated with anything, what the grade of it is, but because they can get Heliobacter and they can get Campylobacter as well, and that can cause tummy upsets. But generally, if you get a good quality raw organ, you can feed that to them raw, or you can freeze it and then thaw it and then feed it to them, because the freezing will kill off some of the potential parasites that might be in there and the bacteria that might be in there. But they are generally pretty good at handling a good quality human grade raw meat. You can cook if you want to, but you will lose some of the nutrients.
Okay, excellent. And what about vaccinating ferrets? Is that something that you recommend?
Yeah, so ferrets need to be vaccinated against distemper virus. So that is a fatal disease that luckily we don't see a lot of in Australia, and that's because we do vaccinate against it. And so we do recommend that when they're little kits that they get vaccinated, kind of like a dog and a cat. They get their initial booster vaccinations, and then we do it every year after that. The other thing that you do have to think about with ferrets too is giving them heartworm prevention. So they can get heartworm just like dogs can. So we do recommend that you treat them with a monthly preventative thing like Revolution or Advocate for cats. So that's a really good thing that you can use for them. It's quite easy to apply. It's just in the back of the neck.
Okay, fantastic. Right, well, should we move on to rats and mice? And if we go, yes. So tell us the most important thing you want us to know about rats and mice.
So probably the most important thing that I want people to know about rats is that, unfortunately, most of them are going to have respiratory disease, and it's something that you need to research about and be prepared to look after, because 9 times out of 10 they will get it. And again, it's something that we can't cure. It's sort of in them, and it's been bred into them over the years. So it's something that we can't get rid of, and something that you need to learn how to manage. And you can do a lot of at-home management before you come to the vet, but also you'll be doing sort of multimodal management at home with medicines that the vets will give you too. So that's the biggest thing about with rats. And then with rats and mice, they are really prone to getting cancer, unfortunately. And so again, you will get probably cancer in one of them. The good thing about it in at least rats is usually it's benign. And so if we remove it, then you've got a pretty good chance of it not coming back. There are sort of about 20% of cases that can turn malignant in rats. But in mice, unfortunately, most of them are malignant. And so with an already short lifespan, if they get this cancer, then it unfortunately decreases it even more. So they're the big things in terms of illnesses that I'd want people to know about. So they're great, great pets. They've got such cute personalities, and I really, really like rats. And they are really fun to have around the house, and they've got this really bad stigma about being messy and yucky and dirty, but they're actually really clean animals, and they don't smell it. They're great to have around, but they're not around for long enough because of these diseases.
Yeah. How long do they sort of live for?
You can kind of get 2 years, 3 years out of a rat. And so it's not very long, and usually a bit shorter for mice, unfortunately. Now that we are learning more and more about them, and we're getting better sort of medical treatment and people looking after them better, we are getting a little bit longer, but it's not a lot longer, unfortunately. Hopefully we'll get there one day, getting them a little bit longer.
So do you recommend people weigh their rats and mice a lot? Like, how are we seeing these cancer lumps, or are we getting to them too late, or what? How do we know?
Yeah, so
without them being huge.
Without them being huge. Unfortunately, a lot of the times, owners will see them when they are quite big, or they will say they're going to look at it and then recheck it in a week or so, and then it's doubled in size. So they can be quite fast growing. But the main thing that I think is important as a pet owner for any of these animals is learning what is normal for your animal. So the one thing that I do tell clients to do is, when you get your animal, is to give them a really good pat. But when you're patting them, to feel them and feel underneath their jaw and feel underneath their armpits and feel in between their legs and along their tail and on their ears, and do that on a regular basis. And so you might then pick up a lump that's teeny tiny, that could be like 0.5 millimeter in length. But because you've been checking your animal regularly, you're going to notice that is different. And then you can go, I know this is something different now. Maybe I might monitor it for a week, but I know exactly where it is. I know how big it was on this day. I felt it on this day. And then that really helps us when we're trying to figure out what it could be in terms of its time course, and the fact that you know that this is your animal and this is what's normal, and now this is what's not normal. So that's really important. That's the biggest thing, I think, even like with rabbits with dental disease along their jaws, learning what is normal along the jaw, what the lumps and bumps of what would be normal for them, and then when it changes. And so that'd be the same with your rats and your mice, looking for those lumps.
That's fabulous advice. Oh, I've got a replay here. I don't know if you can hear me.
Yeah, I can hear you still.
Oh, that's so good. So one of the things that I see a lot of rabbits for is when they get bloat. What are some of the signs that people need to look out for with their rabbit, especially rabbits and maybe guinea pigs a little bit, when they're going, if they absolutely must get to the vet straight away?
So if they do have bloat, we've got to make sure that we figure out whether it's actually an obstruction or if it's just a really bad stasis. Obstruction meaning that there's no food or liquid or gas that can pass through something that's stuck in their tummy, versus stasis, where the tummy slows down to a point where nothing is moving, and that's just because there is sort of something wrong with the peristalsis of it. So it's really important that we figure that out first. But usually rabbits and guinea pigs will eat constantly. They might not eat during the night as much because they're sleeping, but they'll be eating during the day, grazing during the day. So if you ever see that your animal hasn't eaten for longer than 4 hours, then that is something that is abnormal.
So that's 4 hours.
Yeah. Generally it's 4 hours. I mean, there's some bunnies that can go a little bit longer if they've sort of learnt from an early age, but if your bunny is a normal bunny that you see just grazing on the grass or the hay, and all of a sudden you're like, I haven't seen him eating for a couple of hours, then that is definitely not normal. If you then sort of see them lying on their sides or they're shifting because they don't look comfortable, that is something that is abnormal as well. And if their belly looks big, then you need to be getting to your vet straight away. You're getting in the car, driving and calling them, saying that you're bringing a bunny in that potentially has an obstruction or has really bad stasis that could then turn into an obstruction if nothing is moving for long enough.
One of the things that I often get called about on your vet online is the ferret that collapses and is really kind of wobbly and walking not very well. And a lot of the times, sorry?
And sort of, and probably gazing, look like they're stargazing.
Yes, yes. So what do you suggest that might be, and what can people do if they see that happen?
So the most common thing that ferrets get that sort of align with those clinical signs is a disease called insulinoma, and that is a cancer of the pancreas. And so that's where one of the cells in there isn't working properly, and it causes a really bad decrease in their blood glucose, and so to the point where they don't have any energy to really lift their head or do any sort of anything, and so they kind of go all wobbly because they don't have any energy. So if you think that your ferret does have that, call your vet, but in the meantime you can try and put a little bit of honey on their gums to give them a little bit of sugar, a little bit of an energy hit. But it is really important that you get them to the vet straight away so that we can take some blood to diagnose that. Because the other thing you have to think about, if it isn't that, unfortunately the next common thing that ferrets get is cancer elsewhere, and it's usually lymphoma. And that's a totally different ball game that we need to discuss with you. But insulinoma is super, super common and causes a decrease in their blood glucose, makes them really, really woozy, and we need to get that sugar level back up so that they have the energy, because the brain can't handle no glucose going to there. And so we don't want them to go into a coma, and if it's bad enough, unfortunately, sometimes they can pass away before we can treat them.
Yeah, no, I mean, that's one of those things that I often get called about on your vet online, as I said. And yeah, it's really important for people to get that, honey onto their mouth and just get them straight into that clinic, because
try and decrease any external stimulus too much. We don't want them to be overexcited, but we want to make sure that they stay conscious so that we can try and get the treatment into them as soon as possible.
Yeah, no, that's great. Well, thanks so much, Dr. Bree. I don't know if we've got any questions, which is a bit of a shame, but we've had a great chat here, and I hope people have found that really interesting. I certainly have, and I'd like to say thank you very much. And why don't you tell us how people can contact you or check you out on Instagram or Facebook if you want?
Yeah, that'd be great. So I have a Facebook page, and it is Dr. Bree. And so I put lots of stories up there and pictures up there and cases of what's going on. But I also have an Instagram. It's also Dr. Bree. And if you want to...
nice and easy.
It's nice and easy. I've kept it nice and easy for everyone so that you can find me, ask me questions. I'll try... it's hard to give out the perfect platform to ask veterinary medical questions. So it's always hard for me when I get people asking me specific medical questions, because you always want to see the animal like you do via video or by asking questions. But I try and answer as many questions as I can. I love seeing what people are up to and their animals as well. So I quite often try and make it interactive. But you can find me at Facebook, Dr. Bree, or on Instagram, Dr. Bree, and I'd love to see you guys there and learn all about your animals as well.
Yeah. Now, I love keeping an eye on your Instagram page in particular, as you have some great stories on there. So everyone, make sure you check out Dr. Bree's Instagram and her Facebook page. And just before we go, last moments to ask any questions. Is there anyone? Probably not. But if you do have questions,
they can always ask you questions later.
Yeah, exactly. They can ask any questions below, and we can get on and answer them for you. Otherwise, head over to yourvetonline.com. I'm Dr. Leigh, and this is Dr. Bree, and thank you very much for listening tonight. See you guys. Bye.
Thank you.